Dear colleagues, let me introduce our study Influence of extract of cryopreserved piglet skin fragments or aqueous colloidal solution of C60 fullerene on destruction and inflammation severity after skin cryodestruction. Cryoablation is widely used in oncology for removal of benign cutaneous neoplasms and in the combined treatment of malignant tumors. Cryosurgical method has important advantages over other surgical methods, such as ablasticity, cryoimmunization, and analgesic effect of cooling. Skin wounds after cryodestruction have longer healing period in comparison with injuries after electrocoagulation on scalpel excision. Deep cryolesion accompanied by development of manifestation at local and systemic levels. Lipid peroxidation, antioxidant activity, and inflammation markers in blood serum reflect depth and severity of pathological processes. Acceleration of wound healing after cryodestruction with achievement of organotypic regeneration are actual problem which can be solved so the combined therapy with immune biological products or carbon nanoparticles. Extract of piglet skin cryopreserved fragments are known to accelerate the cold wound healing. The research on fullerene C60 started in 1985 when Crota discovered the third allotropic form of carbon after diamond and graphite. Nowadays, C60 fullerene and related carbon-based derivatives have a wide range of the biological applications, such as antioxidants, antiviral, anti-cancer, photodynamic therapy, agents. Preliminary biological studies of water-soluble pristine C60 fullerenes have shown that at low concentrations don't exhibit acute toxic effects on the normal cells, they are not allergenic and immunogenic, and they are able to regulate free radical processes in the cells and tissues. The research aim was to determine the extract of piglet skin cryopreserved fragments and the aqueous colloidal solution of fullerene C60 effects on serum markers level of inflammatory and destructive processes in rats with cryodestruction. The research was performed in sphinx male rats. The intact group consists of 10 animals used for assessment of the normal indices of lipid peroxidation and inflammatory markers, with the remaining 3 groups comparison 30 rats each. All animals except the intact ones were subjected for modeling cryodestruction on lateral surface of the thigh. The extract of cryopreserved piglet skin fragments was administered intraperitoneally once a day in dose of peptides 0.5 mg per kilogram body weight during the whole experiment in this group. A saline solution was injected in the control group. Aqueous colloidal solution of fullerene C60 was used for 5 days in dose 0.1 mg per kilogram in the experimental group. The cryodestruction modeling in the control group was accompanied by an increase of DNA conjugates content by 7th day in 1.7 times, by 14th day in 1.5 times, by 21st day in 1.4 times, in comparison with normal There was a normalization of the DN conjugates content by 21st day in the group with extract introduction. In the group with aqueous colloidal solution of fullerene treatment, we observed normalization of DN conjugates values by 14th day of experiment. The cryodestruction in control group was accompanied by an increase of thiobarbituric acid reactive substances contents in 1.7 times by 7th day. The values of thiobarbituric acid reactive substances were normalized by 21st day of the experiment in the group with extract treatment. In the group with fullerene aqueous colloidal solution treatment, we observed normalization of thiobarbituric acid reactive substances values by 14th day of the experiment. The cryodestruction in the control group was accompanied by a decrease in the activity of superoxide dismutase by all observation points. In the group with extract treatment, the actual activity of superoxide dismutase was increased by 14th day in 1.5 and by 21st day in 1.5 times in comparison with control group. The activity of superoxide dismutase was normalized by 21st day of the experiment. In the group with fullerene aqueous colloidal solution treatment, we observed increasing of superoxide dismutase activity by 14th day in 1.6 time and by 21st day in 1.7 time in comparison with control group. An augmentation of superoxide dismutase activity was not by 21st day of the experiment. In the group with modeling cryodestruction, we observed a decrease in the activity of catalase by all observation points. In the group with extract treatment, the activity of catalase was increased by 14th day in 1.4 times and by 21st day in 1.7 times in comparison with the control group. The activity of catalase was normalized by 21st day of the experiment. In the group with fullerene aqueous colloidal solution treatment, we observed increasing by 14th day in 1.5 times and by 21st day in 1.7 times in comparison with control group. An augmentation of catalase activity to the normal values were noted by 21st day of the experiment. The cryodestruction in the control group was accompanied by an increase of C-reactive protein contents by all observation points. There was a normalization of the C-reactive protein content by 21st day in the group with extract and fullerene introduction. The cryodestruction in the control group was accompanied by an increase of ceruloplasmin content by all observation points. In the group with extract or fullerene treatment, we observed normalization of ceruloplasmin values by 21st day of the experiment. Normalization of the content of DN conjugates and thiobarbituric acid active substances after administration of the aqueous colloidal solution of C60 fullerene was established starting day 14th of observation and by day 21st after application of the extracts. Increasing the activity of superoxide dismutase and catalase on day 14th and its normalization on day 21st of the experiment were determined after treatment with extracts of cryopreserved piglets' skin fragments and aqueous colloidal solution of furan C16. We observed that contents of C-reactive protein and ceruloplasmin decreased for all observation periods, with their normalization on day 21st after treatment with extract and fullerenes. The use of extracts of cryopreserved fragments of piglet skin and the aqueous colloidal solution of fullerene C60 after skin cryodestruction reduce levels of markers of destructive and inflammatory processes in red serum. Thank you for attention.